Vamshi Krishna. Welcome to my YouTube channel. Today we will see some of the basic questions for upcoming staffnet's recruitment examinations. So the first question is, after delivery the umbilical arteries are called. So after delivery of the baby, the umbilical arteries are known as, options are ligamentum venosum, medial umbilical ligament, ligamentum teres, ligamentum arteriosum. The right option is option B, median umbilical ligament. So after the delivery of the baby, the umbilical arteries are converted to medial umbilical ligaments. The next question is, the connection between umbilical vein and inferior vena cava of the fetus. Options are umbilical artery, ductus venosus, ductus arteriosus, pulmonary artery. The right one is option B, ductus venosus. So ductus venosus is a connection between the umbilical vein and inferior vena cava at the liver. Okay, so this is called ductus venosus. The next one is, human placenta is. Options are placenta is discoid shape, placenta is hemochorial, it connects fetus and mother, all of the above. The right one is option D, all of the above. So the placenta has a discoid in shape and it consists of the blood because it is known as hemochorial, and it connects the between fetus and mother. So these three options are correct, all of the above regarding human placenta. The next question is, what is the appropriate weight ratio of the placenta and baby? Options are 1:2, 6:1, 1:6, 1:8. The right one is option C, 1:6. So the placenta has 500 grams and the baby has 303 kgs. So this is an average appropriate weight ratio of the placenta and baby. The next one is the amount of elemental iron in one iron tablet for mothers. So in each iron tablet, how much iron will be having? Options are, what is the dosage of each iron tablet? 60 mg, 50 mg, 300 mg, 200 mg. The right one is option A, 60 mg. So 60 mg, it is a elemental iron in each tablet. The next one is, which of the following is not related to Cushing trait? Options are decreased respiration, that is bradypnea, decreased heartbeat, that is bradycardia, widening of the pulse pressure, and increasing of temperature. So the right option is option D, increasing of temperature we cannot see in the case of Cushing trait. So Cushing trait, it is the condition of the intracranial pressure. Okay, the pressure which is present in the intracranium. So this kind of features we can see in the case of Cushing trait. The next one is, the nurse is treating all patients equally. This is the name of. So a nurse, she is taking care all the patients in a ward. So this kind of behavior is known as. Options are justice, fidelity, veracity, and respect. The right one is option A, justice. Justice is nothing but equally justify the others' feelings and emotions and selecting a solution for the problem. So all the patients are came into the hospital for treatment purpose. So if you give the care for everyone in each way, okay, in equal way, means that is justice. The next one is the largest amount of air which can be expelled from the lungs during maximum respiration is called. The options are inspiratory reserve volume, expiratory reserve volume, residual volume, tidal volume. So which one is the right answer? That is option B, expiratory reserve volume. So first one is inspiratory reserve volume means volume that can be inspired beyond a restful inspiration. So how much ml of the air is taking by inspiration, that is known as inspiratory reserve volume, and expiratory reserve volume means volume which can be expired beyond a restful expiration. Okay, ml of air out from the lungs is called expiratory, and the residual volume is nothing but volume remaining in the lungs after maximum expiration. So the air which is present, okay, after expiration, okay, after expiration, the air which amount of how much amount of air is still is present in the lungs, it is known as residual volume. And the tidal volume is nothing but volume of a single breath. Okay, so at single breath, the how much ml of air will go enter into the lungs, it is known as tidal volume. The next question is, which is the most common congenital abnormality baby with diabetic mother? So if the mother is diabetic, so what may be the congenital abnormality we can see in the baby? Options are ventricular septal defect, respiratory arrest, neural tube defects, Wilms tumor. The right one is option A, ventricular septal defect. This is defect. Okay, ventricular septal defect, congenital heart disorders we can see in the case of mother with diabetes. The next one is the most common complication related to child with bronchial asthma. So if the child is having a bronchial asthma, what may be the common complications we can see? Options are emphysema, atelectasis, pleural effusion, none of the above. The right one is option A, emphysema. So emphysema we can see in the case of child with bronchial asthma. So emphysema is nothing but it is a lung condition, okay, so characterized by the shortness of breath, okay, shortness of breath we can see, and it is due to the damage of the air sacs, that is nothing but alveoli, okay, due to the damage of the air sac, that is alveoli, the emphysema can be developed by the complication of bronchial asthma. The next one is today the drug is. Options are, is it for tuberculosis, is it for antipsychotic, is it for family planning, is it for prevent cross infection? Otherwise it is antibiotic. Is it antibiotic or antituberculin, antipsychotic or family planning? The right one is option C, family planning. So family planning method, the drug is today. So the next question is, the patient said, I have frequent urination. So the patient has saying to the sister, that is, I am going for urination frequently. So it is a type of giving information, that is subjective data, objective data, both A and B, only A. So which one is the right answer? That is only A. That is right option is subjective data. So subjective data is nothing but the patient is saying to the other person. Okay. Objective data is nothing but we are observing on the patient. Okay. That is objective data. The next question is, which among the following condition is accompanied by distant muffled heart sound and prominent neck vessels? Options are cardiogenic shock, cardiac tamponade, pulmonary embolism, dissecting thoracic aortic aneurysm. The right one is option B, cardiac tamponade. So cardiac tamponade we can see by the distant muffled heart sounds and prominent neck vessels, dilating of the neck vessels. That is cardiac tamponade. The next question is structure with functional closure immediately after birth. The options are foramen ovale, ductus venosus, ductus arteriosus, umbilical artery. The right one is option A. Foramen ovale will close after the birth of the baby, that is functionally. The next one is a 25 years old male patient sustained severe burns of the right lower extremity. Okay, so this is the patient and right lower, that is right lower extremity. Okay, this is the right lower extremity and using the rule of Funain, which is the best estimate of total body surface area. So this is a right leg. So if the patient is having burns on the right lower extremity, so how much percentage of burns we can estimate? Options are 18%, 22%, 31%, 40%. The right one is option A, 18%. So 18% we can give for the extremity, that is lower extremities. The next one is dengue fever is caused by bite of which mosquito? Options are Culex, Mansonia, Marstrips, Aedes. The right one is option D, Aedes mosquito. So Aedes mosquito is cause for the dengue fever. The next one is the nurse administer injection MGS4 to a woman who is hospitalized with severe preeclampsia. What medication would the nurse have available to counter MGS44 toxicity? So the patient is having the preeclampsia and for that reason their sister is given MGS44. So if the toxicity increase, what is the antidote for MGSO4? Options are sodium chloride, calcium gluconate, epinephrine, sodium bicarbonate. The right one is option B, calcium gluconate. So the calcium gluconate is the antidote for MGS44. The next question is identify the nails disorder as shown in the photograph. So you can see the photograph, the nail which is abnormal. So this condition is known as, options are anonasia, leukonasia, koilonasia, anonasia. The right one is option C, koilonesia. Okay, koilonesia is a condition. It is the nails are not normal. Okay, this condition is known as koilonesia. The next one is a preferred route of tranexamic acid. Okay, tranexamic acid drug administration is, options are subcutaneous, intravenous, intramuscular, intravenous or intramuscular. Sorry, remove this option completely. Okay, so the right option is option B, intravenous. So this drug can be used for the treat heavy bleeding during the menstrual cycle, okay, in the women. So tranexamic acid, it is a class of medications called antifibrinolytic drugs. Okay, so this action is to improve the blood clotting. By improving the blood clotting, we can prevent the bleeding. So the next question is, identify the following symbol. Okay, see here you can see a symbol. So what is the meaning of this symbol? Options are radiation, biohazard, cytotoxic, radiant material. The right one is option C, cytotoxic. So cytotoxic, it is a symbol of C. The next one is parts of the fallopian tube except, options are hilum, isthmus, infundibulum, ampulla. The right one is option A, hilum. So hilum is not present in the female reproductive system, but this hilum we can see at the entrance of the lung. Okay, entry of the bronchi and pulmonary arteries and veins. So here we can see entrance, this is the lung, and the bronchi will be enter here. So this part is known as hilum. So in the same way, in the kidney also we can see the hilum. Okay, so this is a kidney and this is a ureter, and entry of the blood vessels, exit of the blood vessels, and where the ureter is start, this entry is also known as hilum. So this is the right answer. The next one is, a child with a recurrent upper respiratory tract infections, which complication may be seen? Options are meningitis, acute otitis media, and respiratory distress syndrome, and mouth ulcers. The right one is option B, acute otitis media. So why? Because there is a connection between the ear and pharynx. Okay, pharynx, larynx, oral cavity. So this connection may transfer the infection from the upper respiratory tract infections to the ear. Okay, so it may be the complication of upper respiratory tract infection. We can see acute otitis media, that is infection of middle ear. Okay, infection of middle ear. The next question is, after road traffic accident, a patient was brought to the emergency department after massive blood transfusion. Okay, this is not massive blood loss, this is massive blood transfusion. Which electrolyte imbalance occur in the patient? The options are hypocalcemia, hyponatremia, hypokalemia, hyperthermia. The right one is option A, hypokalemia. Why? Because the blood bag, which is present, the blood. So in this we can see the heparin. Okay, heparin. So due to the presence of heparin, which can cause for the occurring of hypocalcemia in the patient. The last question is the hepatitis B vaccine produced from. Okay, so hepatitis B vaccine was produced by which of the following options? Options are bacteria, recombinant RNA technology, fungus, both 2 and 3. That is B and C. So which one is the right answer? Please put in the comment box. Thank you for watching.